My name is Dr. Heather Towery, and I'm a physician case manager with Advanced Medical. My training is in internal medicine, pediatrics, and nephrology. I recently worked with a 50-year-old woman with a recent diagnosis of multiple sclerosis. She went to see her treating physicians because she was having numbness, changes in her vision, and was just not feeling very well. They did some imaging studies and diagnosed her with multiple sclerosis. This was a very concerning diagnosis for her, as she knows that people can have progressive disability. She's a very high-functioning executive and was concerned about what this would mean for her job, for her life, and for her family's life. Her questions to the expert was, is my diagnosis correct? I've been told to start this medication that's very expensive, that has lots of bad side effects, and I'm not sure it's the right thing to do. She'd also been to several seminars to learn more about multiple sclerosis and just wasn't sure that everything applied to her. So we were able to gather her imaging, her clinical information, and send it to two excellent experts, one the head of the Multiple Sclerosis Center at Baylor, and the other chief of neurology with a subspecialty in multiple sclerosis at UCSF. And they both came back and said that your diagnosis of multiple sclerosis is incorrect, that you should not start this very expensive medication with lots of side effects, and additional testing is needed to figure out what you do have, but you don't have multiple sclerosis. She was elated by this news. She knew that there was additional testing that would be needed, but to not have a diagnosis that would impair her whole way of life and need to go on this significant medication was of absolute relief. She couldn't have been happier working with Advanced Medical to have this information and be able to take it back and share it with her treating physicians.